I'm Dr. Carl Wierks, partner at West Michigan Orthopaedics. We're here today to talk about hip impingement, or FAI disorder, which is a common hip problem in active people or athletes. It develops as growing pain or pain in the side or back of the hip that can interfere with recreational activities or even normal daily activities. In the setting of either the cam or the pincer type impingement, they both result in trauma and eventual tearing to that labral tissue, which causes pain. So the labrum functions like a gasket. It creates a suction seal with that hip joint, but it has a lot of nerve endings in it. So if it gets damaged or torn, then it's a pain generator. That pain is typically felt in the groin, particularly with the hip flexion activities, but alternatively could be experienced or perceived in the lateral side or the back of the hip as well. In the setting of the FAI, that groin pain is typically like sharp and stabbing with higher levels of hip flexion. So the sharp stabbing pain tends to be more positional, but there can also be this underlying kind of inflammatory irritation of that joint that causes more of a baseline, dull, achy kind of pain. The pain can even become quite severe to the point where it interferes with activities of daily living, like sitting, sleeping, just transitioning from sitting to standing can all be problems. FAI or impingement problems typically present as a growing pain, particularly with hip flexion or higher levels of activity. And if that's not improved with initial conservative treatments, including trying to avoid activities that make it worse, you can try NSAIDs, which is like ibuprofen type medications for a couple weeks. That is good to get that evaluated because initial workup would include physical exam, probably getting x-rays, potentially even an MRI of that joint. In either setting, cam or pincer, and about 3/4 of the people have some combination of both, typically with one being primary or more significant than the other. But in either case, those issues can be addressed arthroscopically. So that is a surgical procedure, but it's a minimally invasive procedure, typically done through 2 little poke holes around the hip. And those bony deformities can be reshaped with a burr by trimming down some of the bone there on the neck of the femur or on the edge of that hip socket, and then repairing the damage that's done to that labral tissue.